now recognize Ranking Member Dr. McDermott for his opening statement.
Thank you, Mr. Chairman. Welcome, Mr. Every. I want to thank you for coming to talk to us today, though I can't necessarily promise you a kind reception, as you may have already had a glimmer. My Republican colleagues appear very upset by this decision, despite its support in the business community. They're so upset that they have already run to the floor and put bills out there to repeal all these mandates without having hearings. They aren't even following the regular order in the Congress. They've decided to use this delay, which won't hinder the rest of implementation, to target a much more important provision of the Affordable Care Act, that is the individual mandate. It seems they've discovered in themselves a repressed populism they reserve for special occasions when it serves their no tax, no regulation agenda. Repeal and replace is a great way to tell voters what they want to hear. We're going to keep all the things you like: covering your kids till age 26, closing the prescription donut hole, banning the discrimination based on pre-existing conditions, and get rid of all those things you don't like, eliminating free riders and telling employers to pay their fair share. That's what they're promising. Now, this is easy to say because they don't intend to fulfill the replace part of it. If they did, they would have to come face to face with the hard truth that one makes the other. The individual mandate makes possible the ability to give people insurance. Guaranteed insurance coverage without a mandate isn't insurance at all. It's just an elective bill payment. Given the opportunity, who wouldn't put off paying until they need to use their insurance if they knew they could get it at any time? Some states have tried to implement reform with all the benefits and none of the costs. Washington State, my own state, has been through this. 1993, we put in a universal mandate, and we put in insurance reform that ended denial for pre-existing conditions. Without any leverage to keep healthy people onto the insurance rolls, however, when they repealed the individual mandate, only the priciest patients remained, and insurers began a financial death spiral. Under Mitt Romney, the Republican presidential candidate, Massachusetts got it right. With an individual mandate, employer mandate, and subsidies, the uninsured rate was cut to 5.5%. When the insurance industry had guaranteed customers, it could take everyone without decimating the market. Romney called the individual mandate, quote, the personal responsibility principle. Everybody in this country should be personally responsible for themselves to the extent they can, and explained that it was essential to, quote, getting everyone the health insurance they deserve and need. And when his stance may seem bravely bipartisan now, we have to remember that this idea of a mandate came from the right. George W. Bush used it to make his health care plan or proposal work. In 2000, Jim McCreary, who sat on this committee, was once the chair of this subcommittee and the ranking member of the Ways and Means Committee, as well as a member of the RNCC. He supported an individual mandate. Here's what he said: we need to think of a better way to deliver some health insurance to everybody in this country. As far as I'm concerned, that means an individual mandate. Gingrich supported it, and indeed the then Republican minority made it the foundation of their alternative to the efforts by Mrs. Clinton in the early 90s. All the way back to 1989, the Heritage Foundation, a think tank that no one would accuse of being moderate, much less liberal, released a proposal that some credit as the mandate's first appearance. Even President Nixon relied on an employer mandate in his reform plan. Personal responsibility and eliminating free riders is usually, and I emphasize usually, the hallmark of conservative policymaking. People should be responsible for themselves. The reason they want to get rid of the safety net, people should be responsible for themselves. So after decades of Republican support for an individual mandate. What's changed? Republicans know that health reform only works if everyone has skin in the game. And at some point, I have to ask, do they really want it to work? Do they want to help some Americans get affordable coverage? If you won't accept the Republican ideas in the ACA, what's left? I never wanted a mandate personally. Asking the business community to be responsible for covering our insurance doesn't make much sense to me. I fought for a single-payer system that recognizes that our government has a social and financial stake in the health of all our citizens. But the private insurer market system won. The Republicans won this debate when the ACA was put in the way it was. This is a compromise that we found. Everyone participates, so no one is denied. Now, endless futile attempts to repeal won't help anyone, nor do non-existent replacement plans. We've done this. This is the 38th time. We will do it this afternoon about 3:30 or 4 o'clock. The American people deserve a health care system that works. Let's get on with the show and let people and the coverage they need and deserve. I yield back the balance of my time.